Hi, I'm Dr. Vipul Patel from Ohio State University, and I'm the Director of Robotic Surgery at that institution. Well, I think robotic surgery definitely provides some advantages. These days, most of us are trained in laparoscopy and in open surgery, and I think robotics really takes us to the next level. It provides us 3D vision, magnified times 10, small robotic wrists that really allow us to suture and dissect very well laparoscopically. So I think for the young surgeon, the key is this is definitely not going away. And I think for young surgeons, it will impact their career. So most likely, they will end up learning robotics in some form throughout their careers. I think a big testament to that fact is the fact that in the United States, over 50% of all the prostatectomies that are done there are now done robotically. And that, I think, makes quite a statement. Well, my robotic experience is now about 5 years old, and we started really when there was very little out there. There were very few mentors, very few videos, and so we really went through a true learning curve. I think these days it's much more easier to start, as there are a lot of people who can mentor you, a lot of videos, a lot of training facilities. But our experience is about 5 years old now, and we've done about 1,700 cases of prostatectomy and about 100 of pyeloplasty. Well, I think the new generation of surgeons are adapting very, very well to robotic technology. It seems to be more and more natural for them. There is a learning curve, as with any procedure and any technology, and approximately 25 to 40 cases for basic comfort and competency. And then, of course, there are more advanced learning curves as you get to harder cases and also as your expectations get higher and higher. First, I'll comment on what we have now. 1,700 cases later for prostatectomy, we're able to comment very clearly on outcomes. For margins, which is the short-term surrogate for cancer control, we have very good margin positive rates. Continence appears to come back very, very quickly with robotic surgery, and we've really found the biggest advantage in prostatectomy of the robot is nerve sparing. We're able to be very, very precise, and the potency rates at 1 year are right about 90%, so we're seeing very, very good results. These will continue to get better, and I think the reason they will get better is new technology, new innovations. The robot now has HD vision, which is even better than the traditional vision we have. There'll also be a lot of integration of other technologies, intraoperative ultrasound, MRI, pre-op simulation of surgeries before you actually do them. I think all of these will really take us to the next generation of robotics and of surgery in general. For robotic surgery, for us, is quite simple. A brief overview of what to expect. Our operative times for prostatectomy are about 1 hour to 1 hour and 15 minutes surgery time. The blood loss is very, very minimal at about 100 cc's or less. No transfusions or blood donations, those aren't necessary. Our patients go home the next day, and most of them are not taking any narcotics. The catheter usually comes out in about 4 to 7 days, and the continence and potency seems to come back very quickly. So I think the advantage for the patient is it's minimally invasive. Earlier back to work, less trauma. But now we're also seeing the functional and cancer results also being very, very good. So we're able to achieve all the parameters that we're looking to get better at.